Welcome back. Now to an important discussion about the number of medications people are on. According to the CDC, 1 out of every 5 adults over 40 is on at least 5 prescription drugs, if not more.
Wow. It has led to an increase in what medical experts call polypharmacy, and it can have some serious side effects. But a lot of times, taking these medications can't be avoided. So we have ABC medical correspondent Dr. Darien Sutton here to talk about it, picking his brain about it. So many people on a lot of medication. Medicine's supposed to be good for us. It's not supposed to gang up on us. What are the risks here?
Yeah, there are many risks here, and it's something that I'm constantly talking to patients about within the emergency room. The first thing I'm questioning is, why are you on these medications? And often an answer is, I'm not sure. I'm not sure how long I've been on that medication, and I'm not sure of those risks. So what are those risks? We're talking about problems with bleeding, blood sugar, blood pressure. These are problems that we try to fix with medications, but can often be the side effects of common medications that many people use.
And for people who are on multiple medications, what's the recommendation and when is the time to cut back?
You know, I think you have to be fully aware of the medications that you're taking. You know, we're all aware of our bank accounts. We're all aware of the amount of money that we have, but many people don't take that amount of care when they're looking at their medications, their prescriptions, and the amount of medications that they take. So number one, understanding how much medication you're taking and having an open and honest conversation. I think a lot of this has to do with loss of the ability or access to primary care providers, who were the mainstay in medication reconciliation, which is that art where we basically go through medications, understanding why you're on certain things to make sure that we're not having interactions with medications, and we're also not suffering from side effects that we can avoid.
I'm curious, I have a two-part question.
Yeah.
What are doctors doing to help solve this issue? Because you may be prescribed by one doctor for one thing and then you go to another doctor for another, so now you have multiple. Is there something they're doing? And also, what should you be doing to protect yourself?
You know, that's important, especially having a conversation as physicians. It's sometimes failed or missed. There are so many things going on within a hospital and even in a patient meeting that you may not be able to touch on every single medication. And also, like you said, sometimes as doctors, especially with specialists, you're prescribing one medication for your specialty, not realizing necessarily that another medication is being prescribed. Sometimes a pharmacist is the only person that really understands how many medications the patient is on. So number one, making a list, making sure you understand what medication it is, why you're on it. You can talk to your pharmacist about medication reconciliation. They can go through your medications to make sure that you're not duplicating or taking medications that are interacting. And then in general, I just think always asking the important questions. Why? What is the minimum dose? Can I avoid this medication? What lifestyle changes can I do to avoid this medication? Those are conversations and questions you should be asking.
You have to be aggressive. You have to be your own advocate.
You have to be.
What is this list, sir?
And also,
ma'am, what is going on?
Truly, and being aware of over-the-counter medications that can interact. Many people don't realize things like NSAIDs, the common ingredient in ibuprofen or Motrin, can raise your blood pressure. Ginkgo biloba, which commonly is taken for memory, can make you have more bleeding. You know, these are things that we have to talk about because it's not just the prescriptions, it's also over-the-counters and supplements.
All right. Thank you so much. An important conversation. We were talking about this upstairs because, you know, whether you're over 40 or not, you should still be focusing, and even if you're younger than 40.
And that's what was inspired by this article from the New York Times. It can start in the 20s. You know, many people who have chronic disease earlier in life end up on medications that they don't need.
All right, Dr. Darien Sutton, thank you so much.
Of course.
See you next time.